Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. First and foremost, I would like to graciously welcome all today's participants to this event. And before we commence the program, inshallah, we would like to invite together our grade 1 student, Malik Ahmed, to read a selection of verses for us from the Holy Quran, followed by a dua, inshallah.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قاف والقرآن المجيد بل عجبوا أن جاءهم منذر منهم فقال الكافرون هذا شيء عجيب أإذا متنا وكنا ترابا ذلك رجع بعيد قد علمنا ما تنقص الأرض منهم وعندنا كتاب حفيظ بل كذبوا بالحق لما جاءهم فهم في أمر مريج أفلم ينظروا إلى السماء فوقهم كيف بنيناها وزيناها وما لها من فروج والأرض مددناها وألقينا فيها رواسي وأنبتنا فيها من كل زوج بهيج تبصرة وذكرى لكل عبد منيب اللهم ارحمنا بالقرآن واجعله لنا إماما ونورا وهدى ورحمة اللهم ذكرنا منه ما نسينا وعلمنا منه ما جاهلنا وارزقنا تلاوته آناء الليل وأطراف النهار.
MashaAllah, tabarakallah, barakallahu feek, Malik Ahmed. Thank you very much for the beautiful recitation and the dua. Moving forward, I would like to once again send my greetings on behalf of Spectrum to all the community with us, available today with us in this webinar titled A Safer Spectrum Community COVID-19 Awareness Webinar. I am Anas Tulib and I will be your host for this session, inshallah. We are fortunate to have with us today Dr. Govin from KPJ Tawakkal Specialist Hospital. Dr. Govin is the Deputy Chief Nursing Officer, and she's also the COVID-19 Preparedness Team Coordinator, the team overseeing the whole daily operation for COVID-19 clinical services. She's been involved in nursing since 2002. It's a very long time. So welcome, Dr. Govin, with us. And KPJ Tawakkal Specialist Hospital, for those that are not familiar with it, is a hospital located in the heart of Kuala Lumpur. It's a member of the KPJ Healthcare Berhad Group. They provide a full range of healthcare services by 70 specialist consultants and supported by about 700 employees. They serve more than 17,000 inpatients and about 180,000 outpatients a year, of which approximately 5% are international patients. We also have with us today our school principal, Mr. Brown, who would be giving the opening remarks before we proceed with the presentation from KPJ from Dr. Govin. So please welcome with me, Mr. Brown, please.
Jazakallah khair, Brother Anas. Thank you for the introduction. Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. So I'd like to welcome all of our parents and students and teachers to the Spectrum International School webinar in collaboration with KPJ Tawakkal Hospital. And just to say, Ahmed, year 1, Barakallah fi, wonderful recitation, Jazakallah khairan, really enjoyed that. So I just basically wanted to start with a reminder in terms of the hadith of the Prophet Muhammad how the Muslims should, what is our belief? It's very important that we keep things in perspective, and how do we believe in terms of this pandemic and any events like COVID-19 or any illnesses, ailments that might happen. And the general belief is that we do believe that it is a mercy from Allah subhanahu wa ta'ala, and it also can be a punishment for others, as mentioned in the hadith of Aisha, narrated by Aisha, radiallahu anha. Next slide, please, Osama. So in this hadith, she asked the Messenger of Allah sallallahu alaihi wasallam about plagues. And Allah's Messenger, Muhammad sallallahu alaihi wasallam, he informed that plagues was a punishment which Allah used to send on whom He wished. But Allah made it a blessing for the believers. So none among the believers remains patient in a land in which a plague has broken out and considers that nothing will befall him except what Allah has ordained for him. But Allah will grant him a reward similar to that of a martyr. So here we learn from the Prophet Muhammad that any sickness, any ailments, any plagues such as these, it can be a form of punishment for those that commit sins or who transgress the limits of Allah. But also it can be seen as a test for the believers, a means of purification and a form of mercy for the believers. So the believer, he does not have any anxieties or sadness, or he has worries. Even if he's pricked with a thorn, we see that Allah can remove our sins. It's a way of expiating our sins and the mistakes that we make. So another aspect in this hadith, which is very important, is it does mention that none among the believers remains patient in a land in which a plague has broken out. So as the Prophet says, that if you hear of an outbreak of a plague in a land, you do not enter it. But if the plague breaks out in the place where you reside, you do not leave from that place. So this is a good reminder for us all that if there is a plague in a land, we do not go there. If the plague breaks out here, then we remain patient and steadfast, inshallah ta'ala. And also I wanted to share with you another hadith. If you go to the next slide, Osama. This hadith is narrated by Anas ibn Malik, radiallahu anhu, who is an illustrious companion of the Prophet ﷺ. And it's a tremendous hadith, and it's one that we're all familiar with. As a man said, "O Messenger of Allah, ﷺ, should I tie my camel and trust in Allah, or should I leave her untied and trust in Allah?" So the Prophet ﷺ said, you tie her and then you trust in Allah. So he's given us the means. He's told us basically that we must have that tawakkul in Allah, but you must take the means. So in other words, what have we been advised by the MOE? What have we been advised by the MOH? We've been advised that we should use hand sanitizers. We've been advised that we should wear the face mask. We've been advised about social distancing. So these are all the means that we should take. So you take the means first, and then you have that trust in Allah. So just a reminder to us that we do all we can to safeguard the community, to protect ourselves, but we must also remember that we have that trust and reliance on Allah subhanahu wa ta'ala to protect us. So it goes hand in hand. We don't just say we're going to trust in Allah and not take the means. So this is a good reminder for myself, first and foremost, and a reminder to the whole community that we need to take the necessary steps to protect our community. And this is why, it's of great privilege and benefit to us that Dr. Govan has come to share with us her experience and her knowledge. So it is an honor. So we have to listen attentively to what she has to say, because she's going to give us the means, and we need to adhere to that, and we need to practice it and implement it for the benefit of not just the school per se, but the whole community in Malaysia. So it gives me great pleasure to welcome her. So I'll hand back to Brother Anas, inshallah ta'ala. And so I hope you find the presentation very fruitful. Okay.
Thank you very much. Thank you very much, Mr. Brown, for the beautiful reminder. And everyone indeed has a role to play for a safer community. Before we proceed with the webinar, Please note that throughout this live stream, you may ask Dr. Govan questions using the QR code at the bottom right corner of the presentation that you would see. So you may scan the QR code if you wish to ask questions to Dr. Govan, and Dr. Govan will be responding to the questions during the webinar if we do not exceed the time. Without further ado, I would like to welcome Dr. Govan to present her speech. Bismillah.
Thank you very much, Encik Anas. So can you hear me clearly? Can everyone hear me clearly? Yeah, so I shall start now. Thank you for the great opportunity given by the Spectrum International School. So today I'm going to talk about what that having make us so scared and make us to stay at home and make us to have a new norm of life, COVID-19. So we call it as pandemic COVID-19. Okay, so when a pandemic occurs, it should be like we fight it together. It's not a single person to handle this. It's everyone. So everyone need to involve in this. That's the reason it is our attitude at the beginning of a difficult task, whereby we have to control this COVID-19 more than anything else, which will affect the successful outcome. So without us being together, we can't go through COVID-19. So today, whatever I'm going to talk based on these outlines. So of course, a little bit of introduction on COVID-19, current Malaysia situation and what we have done, the transmission and the risk. Just a brief one. I think by now most of us know, and also some terms definition clearance over here. The next slide, please. Okay, what is COVID-19? So everyone knows it's a coronavirus, and it's a human and animal pathogens. So it's a kind of pathogens, and why it been called as COVID-19? It been start to be identified in 2019. So that's why it's been called as COVID-19. And it's a novel. Novel means a new virus. So we have a seasonal virus, coronaviruses. But this one is a novel, a different kind of virus that has been identified where? I think everyone knows it, in Wuhan, a city in the Hubei, China. Okay? And it's rapidly spread. It's spreaded very fast, and firstly it's resulted in epidemic throughout China and followed by increasing in number, and it spreaded to other country, and we call it as pandemic. Okay, and here in January 2020, WHO officially declared COVID-19 as an epidemic, as a public health emergency of international concern. So everyone know it's became a pandemic. So the entire world been affected by COVID-19. So next, please. A little bit understanding of COVID-19 transmission. Everyone knows it's like from a person to another person. Can animal give us COVID-19 by airborne or by droplet method? It's not been proven yet, but it's from a person to another person. Next slide, please. Okay, before I go further on the spreading mechanism, so maybe a little bit understanding on endemic, epidemic, and pandemic. So endemic means a breakthrough happen in one area of a place, and endemic will be like it spreaded more worstly, and pandemic to the entire world. So that's the reason we call it pandemic COVID-19. Okay, next slide, please. So here you can see how COVID-19 being spreaded, all the red highlighted area of the world. Next. Okay, what we still can look at the history. Okay, do this kind of pandemic happen before? Yes, we can say the history repeated. Okay, so it's happened previously. So in 1918, Spanish is similar, something similar, but it's not the same virus. Caused a pandemic at that point, but our world can go through it. So the challenges still the same, but at current point, we can face it even better because of the technologies. Next slide. Okay, so this is origin of COVID-19. So this is one of the origin. So it's started, everyone knows it started from bats. And from bats, it means animal to another animal. And from there, after the humans start to eat the animal and they start to have it. And they spreading it through droplet mechanism, which I will share later. Okay, how deadly this disease can be. So everyone been scared once upon a time about Ebola, MERS, smallpox, SARS. So when you look at the graph over here, it is not as deadly as Ebola or MERS. It's stand at the middle. Okay, so if we can control it well, we definitely can save life. And also the symptoms caused by COVID-19. Move forward. Okay, so where does this COVID-19 viruses affect? It's affect the lungs. That's the reason everyone is wearing masks. So it's affecting the lungs. So through what? How? By inhaling the droplet, and it's entering the lungs of a person. In short, okay. So it will enter by very small particle to the lung, through the throat and to our lungs, which can cause further complication. And it would start with the minor symptoms like sore throat, fever, some flu symptoms, and then if it gets worsened, it will definitely affect the lung. Move forward. Of course, as I said, it's not causing, it's not deadly as other viruses, but it can cause that which been caused by acute respiratory distress syndrome. That is what we call as ARDS. So when it's affected the entire lung, the patient can collapse due to the lung failure. Move. Okay, so I think everyone have some understanding about COVID-19. By now, everyone knows, okay, it's a lung disease. It's caused by flu, sore throat kind of thing. So what it caused to Malaysia? What it caused to Malaysia? MCO, Movement Control Order. And I believe we are facing it again in Malaysia in a different form. So in March, we started to have this MCO in Malaysia, whereby complete lockdown and only certain mobilization. Move on. Okay, and what happened to our public response? I think this not been repeated during this MCO. Panic buying. Everyone rushing to market to buy things, to stock up. They started to be very worried about the situation that gonna attack them, and then end up no mask. The stock of masks start to finish at that point, but thank God now we recovered very fast and we got a lot of stock of masks, and you can see multiple color of masks came out. You see, this is how human improve with their action to safeguard the world or the country. And this is to showcase how infectious this COVID-19 can. When it will be very infectious after day 3, day 4, when the person already acquired complete virus in them. Next. Okay, this is some brief. I already spoke about this, but this is some brief. Okay, when infected person without mask started to cough or sneeze out, the droplet from the sneezing or from the person talking will be out to the air. The heavy one will drop down. Of course, the light one will float in the air and goes to another person. Whereby if the droplet drop to the surface, another person touch it and without sanitize their hand or what, touch their face or what, they bringing the virus to their face. That's why they ask us to follow the social distancing. So what can safeguard here? By stopping the droplet and also having a social distancing. So what are the range of distance we are focusing here? About 1 meter apart. So the droplet, it's a heavy molecule. It will drop on the floor, on the surface, rather than it's flying to another person. Move on. Okay, also this is describing the heavy droplet will drop down, the light one will float to the hair and goes to the next person. Move on. Okay, so who will be under risk? Okay, which is focusing on the comorbid of a person. If a person is like having sick, they are on two types of medical drugs like hypertension, diabetic, and especially focusing on age range more than 16 years old. Of course, they are under risk category. And also people are comorbids that having a immunosuppressed disease, on chemo drugs, or they are on multiple drugs. They can be the risk person who can acquire COVID-19. And look at kids. Children seems less having less risk. Why? Not really proven article or journal come out for this, but yet we children have to be careful as well. Move on. Typical symptom of COVID. I think by now everyone know. Are you having fever? Okay, don't come near me. Go and see doctor. Take your COVID test. So fever is the main thing that can be caused by COVID. Dry cough. Person can have a sore throat and then start to cough out. Fatigue, unusual fatigue. The person start to have a kind of tiredness, and it will be very unusual. And then some sputum production, and if the COVID symptom is getting worse, the person will start to have shortness of breath. They can't breathe like normal person. Myalgia and arthralgia, meaning it's like body pain, joint pain, body aches, sore throat, and also headache. To add on with these symptoms, currently people are presenting with other symptoms like loss of smell. The person can't smell, loss of the smell sense. They can't smell fragrance. They can't smell as usual. And also loss of taste. They can't taste food, mainly salty, sour. They can't taste it. That will be considered as they already acquired these viruses quite long time. And also some of our patients coming with a different kind of symptoms like back pain which looks like a bone related disease, but it can be a COVID as well. Okay, so these are the COVID symptoms. Okay, move on with the definition of cases. So who will be a person that called as close contact? Close contact meaning a person who met another COVID positive person without controlling the source. What will be the source is not wearing mask, less than 1 meter, and also more than 15 minutes. They will be highly defined as close contact. So that's the reason government and also everyone is reinforcing on wearing masks all the time. Keep distance, no prolonged conversation. So if we avoid that, we are avoiding this close contact. Comes to another term that routinely used, person under investigation. The person who had close contact, they can be person under investigation. The person who developed symptoms that I presented just now, they can be a person under investigation. The person who traveled to this country which been identified as a COVID country can be the person under investigation. Now in Malaysia, the person who had traveled to a red zone also can be a person that called a PUI, person under investigation. Next, yeah. What we can do if we have symptoms? Okay, next. Okay, firstly, when we have symptoms, a normal fever also can show us a COVID kind of symptom. First, don't panic. Try to recall, have you talked to anyone without your mask, without the proper distancing? So you try to do your own contact tracing. So then from there you can know that you are having a COVID symptom or it's a normal symptom. Still normal fever are existing, so don't worry. So you mustn't get panic. You try to recall by your own self. Okay, maybe next slide. Okay, so when you let me finish with the mild symptom first. If you have mild symptom, of course, try to go and check your self with any doctor. If the doctor suggesting a swab, of course you have to do a swab. If the doctors are not suggesting a swab, try to stay at home, isolate from people, treat your symptoms. If you are well and you are okay, you are not having a persistent symptom, so you are a safe person. If you started to have severe symptoms, next slide. A severe symptom like a short of breath, which I mentioned earlier, so immediately go back to doctors and get your swab done and get treated. Okay, this COVID also been categorized as stage 1, 2, 3, 4, and 5. And currently what government is saying, stage 1 and 2 can be self-quarantine at home, and 3, 4, 5 need to seek immediate treatment from the hospital. Okay, how about the recovery? If with mild cases, the recovery will be about 2 weeks time. If severe cases, 3 to 6 week time. If still unclear how long patient can be recovered completely from COVID. Okay, next. Okay, what the best we can do? Of course, again, break the chain. So if you know you are carrying a COVID virus in you, try to isolate yourself. Do good to the community. So isolate yourself, get treatment, follow the quarantine order, do your swab before you come back to the community. That's the best thing. Next. And also, we have to contribute to the society to flatten the curve graph over here. Next. Okay, so of course, we are one of the country that try to beat the COVID-19. Move on. Okay, so now we already started to, as I mentioned earlier, we started to have our new norm. So those days we used to carry a lot of things in our bag or in our pockets. Now what you have to carry? Additional masks, you have to carry hand rub, and you have to start to choose your weapons, like you have to protect your own self. So that's why we say COVID-19 is mainly about you protect your own self. Move on. So in hospital, so a little bit of what we are doing in Tawakkal. So we work as a team. Of course, we follow the best SOP and start to change and follow the new norm within us as well. Next. So pandemic, what have pandemic changed? So we are wearing masks all the time. Those days, you roughly, hardly can see people wearing masks. But nowadays, everyone with masks, with colorful masks, all kind of masks, but choose the right mask to wear. We have to enter, we have to declare whenever we enter everywhere. Even you go to shopping mall, you have to fill up your My Sejahtera before you enter. And then you have to check your temperature at all the entry points. And also we might minimize people like lift. You have to enter 2 or 3 or 4, 6 people. And then no gathering. Know your family status at all the time. Monitor your own self, and lives go on with that. Next. Okay, so with that, I think, I'm a little fast, I believe. So we have some time for Q&A. So thank you so much. Be safe, stay safe. So I pass to Mr. Anas.
Thank you, Dr. Govin. We thank you graciously for your enlightening and informative presentation. We at our school, we do our best to make sure that our community is very, very safe. We do follow SOPs and guidelines by the Ministry of Health. We have a number of questions that came during the session from participants. First is a parent of our student by the name of Dia. He says lots of people, there's a stress on it, tested positive for COVID-19 with no symptoms at all. How can you explain that?
Okay, thank you for the questions. So the most worried part here, asymptomatic COVID-19 carrier. So the symptoms start based on the person immunity. So if their immunity is low, they will start to get symptoms fast. If the person immunity is good, they can be the carrier and they not having any symptom, but they can pass to people. So that's why you are not only to be aware with people who are having symptoms, you also have to be aware with anyone. So asymptomatic person who bring COVID-19 are most dangerous than the one with symptomatic, because when we know someone has symptoms, we try to distance ourselves, we try to wear our mask properly, so we try to cut down the duration we are with them. But the one that without mask give you a comfortable feeling and you feel like, okay, I think that person is okay, healthy. So here, how you expose yourself more. So symptom is based on the person, the individual immunity. Okay, so what we have to do, we have to treat everyone the same. Of course, when the person have symptom, they can spread it directly. The person without symptom, they can't spread it directly, but eventually they spread it by creating the trust that they are okay. So I think this will answer the question that we asked.
Thank you very much. The second question we've got is, for how long does the COVID-19 vaccine protect our bodies effectively?
It's a good question. We haven't get the vaccine yet, right? So usually any vaccine will have the duration. Okay, so I haven't get any. I haven't read any article saying how long it will protect our body. Of course, we need to repeat it like a flu vaccine that we are taking routinely.
Great. And the third question that we've got is, if I have got COVID-19, do I still need to take the vaccination?
Okay. Definitely I will say, because it's to protect you from second infection.
Right.
But the doctor won't give you won't administer the vaccine while you're having the symptom.
The fourth question is from a parent, Ms. Nurul. She says, how can we know that we have the symptoms? Do we have to get all of them together, all the symptoms together, or let's say, or is it just one symptom means that we might have COVID? Like I believe she's asking about, like, loss of smell or tasting, or without any fever.
Yes. Some people, they might not have fever. They might get a mild sore throat, and then after a few days, they can end up with having loss of smell or loss of taste. So it's like a mixture symptom presentation, I can say, through experience and also what been shared by others. So what is the best when you have a symptom and it's persistent? Kindly seek treatment and also get advice.
Great. And by a question by Mr. Usama, which type of mask can we use is better than N95 mask?
Okay. N95 is mainly used by the healthcare providers. So there is no strong suggestion by anyone N95 to be used by lay people. Okay, so N95 is highly suggested for healthcare providers who treating or taking care patients. So for others, surgical mask 3 layer is the best.
All right, and we have a question by a parent. Must be from the either the KG or grade 11, because his question is, how can we balance between going to school for education and the health challenges of COVID-19?
It's a very good question. Even as a mother, I'm contemplating it as well. Okay, so now still MCO. The moment the school started, how I'm going to prepare my two boys and send them to school. Okay, how we want to balance? Of course, SOP. Again, we have to teach our kids about the SOP. They have to strictly follow these three things. Okay, what we are reinforcing is wearing your mask all the time, keep your distance, not prolong conversation. So if you have your mask on and you're keeping the distance, if you are in your classroom, you are in always in a safe zone, I would say. So we have to reinforce this to kids. And of course, each time you touch any surface or you touch your friend or what, hand rub your hand. So this is how you keep yourself safe and also keep others safe. So reinforce this to your kids at all the time, which I'm doing. I'm doing to my 9-year-old boy and 5-year-old boy. So you can do it as well.
Great. And we have a parent also asking, from your experience, doctor, what is the infection rate and the dangers for early children, for basically young, I believe, let's talk about the young kindergarten kids and the primary.
The infection rate, okay, I'm not having it by hand, but it's very low in compare with adults. But remember, if the parents start to be infected by COVID-19, by after all, they can spread to their kids because they are living together. Okay, so if it's in among the kids, I wouldn't say they won't get it, but they will get it. Depends on the rate of exposure.
Great. We have a question for Mr. Brown, and then we're going to ask more questions that came for Dr. Govind. Is that all right? We'll just give Dr. Govind a break for a minute or two. So a question for Mr. Brown is, how the school SOP will prevent the virus spread in the school community? So basically, what is the school doing to help prevent the spread of the virus?
Okay, so basically the school, we have to follow the MOEs and the World Health Organization's recommendations. So we have a standard operation procedure that we have to follow. Now, the guidance that they give us, for example, the Director General came the other day to visit the school, did an inspection, and he could see that we've got all the SOP in place. So, for example, outside every classroom, we have the hand sanitizer. So students are expected to use the hand sanitizer on a regular basis. When they come into school, we have to use the MySajara. So the parents, they use that. The students have to complete the health declaration form as well to confirm that they are free from the COVID. So all of these measures are steps to try and help the community be safe. So we test them before they enter the school building. They have to take their temperature, and we've been advised that anything above 37.5 degrees is a concern, so they're not allowed to enter the school. We've also put in that measure for the parents not allowed to enter the school building because the school building is being sanitized, so we want to try and keep it that way. So parents are not allowed to enter, only at the moment the year 11 students and the kindergarten students. We have a one-way entry for the year 11s, so they enter via the staircase going up to the top floor. The kindergarten students come in through the ground floor. So again, we're keeping the students separated, the year 11 and the kindergarten students. It's compulsory for them to wear the face mask when they're moving around the school. Again, limited numbers of students are allowed to use the toilet at the same time. The seating arrangements in the classrooms, students' distance is 1 meter apart from the chairs and tables. So we're trying to implement all of the SOP and encourage the students to follow that. And like I said before, that as long as you're taking the means, then we have to have that trust in Allah. We have that tawakkul. So we're putting the measures in place, and we're encouraging the whole community to, support us in terms of implementing it. So that's what the school's trying to do, inshallah, to try and make sure that we keep the pandemic away from our students, inshallah ta'ala.
Alhamdulillah, that's great. Thank you very much. And moving to the next question for Dr. Govan. A parent is asking, what if we are infected with mild symptoms and have no quarantine at home? What is the best medicine to cure ourselves at home?
Okay, actually, if you have mild symptom, let's say like a flu or like a fever, so it's very much to symptomatic treatment. Like fever, you have to take your Panadol, your flu medication. But if you a person which under quarantine, of course you have to completely quarantine yourself. If your symptom persisted, eventually you start to have shortness of breath or what, immediately you have to call for help.
Great. And the next question, thank you, Doctor. The next question is, how can we enhance the immunity of our children beside the healthy diet and physical activity?
This is a very good question. Of course, nowadays we are talking about vitamin C. That would be a part of enhancements of immunity for our kids. So maybe you can start to give vitamins for your kids, and also you can start to consume by your own self some vitamins with a recommended range or dosage.
Great. And the next question is came from a parent. It says, I have heard about a case that reached the level of losing sense of smell and taste, and they kept ignoring it till they recovered. Up to which level can the patient cure himself without medical intervention?
Actually, for sense of smell and also loss of taste, there's no medication will be given for that purpose unless based on the investigation done by a doctor and the patient need antivirus treatment. So it will be settled down when the infectious rate in the body goes down. So at the stage 4 or 5, if the patient having high load of virus, the patient will be treated with antiviral.
Thank you very much. And the next question is for Mr. Brown. It's a question from a parent. For school, how do you see the challenges of education in light of COVID-19? How was the preparation for the Haze experience? And what is school's next step in the coming days and future?
I think if we cast our mind back to a few years ago, the school made a conscious decision to look at a specific platform to use in school. So we started to use Google for Education, and we decided to ensure that every student had a laptop. So it was a one-to-one system that we put in place. So we find in terms of the education, the structure is already there, which we've already been implementing. And I mean, that came to fruition. If we look, for example, on the 18th of March, there was the MCO. And when it was announced, I know some schools closed, but our school, the very next day, was able to continue with the education, and we continued with the full timetable. So, and that was because we've already got the Google Classroom in place, the platforms in place, we've got the spectrum education modules and so on. So we've got the resources and the infrastructure in place for education to continue online with the blended learning. So this is already happening, and I think it's going to continue. There's going to be periods of time where students are in school, and then there'll be times where the MOE suggests that students are out of school. But from our perspective, Spectrum International School, if the students are in school or if they're out of school, the learning will continue because we're doing the blended learning. They're using the laptops in the classrooms, they're using the My iMaths, the Twig, they're using Q files, they're using all these educational softwares in the classroom. We have interactive panels in place, so students have access to all the resources. So whether they're in school or at home, the education will continue. I think if you're asking about the challenges, I mean, the main challenge that I foresee is the education in terms of examinations. This is a challenge. I mean, what we've decided to do as a school is to use the Chromex. So we can set examinations online, and the way that it works with the Chromex is that it blocks all of the tabs. So students are not allowed, they're unable to access Windows or unable to access the internet. So it's all blocked off, so we can literally look at the camera and see how they're doing the test. So this is something that we're revising and we're refining that process. But I foresee in the future that some of the education authorities like Cambridge, Edexcel, they will have to possibly go with online education in terms of examinations. I foresee that this will happen because at the moment, they're indecisive whether or not the exams are going to continue or whether they'll go with the predicted grades like they did last year. So that's one of the challenges, I think, for education is how to do online assessments. But in terms of the education per se in school, I think with the blended learning, it's been education as business as usual. Inshallah ta'ala, and Allah knows best.
Great, thank you very much. We have I don't think it's a question actually from a student saying, do you see the light at the end of this pandemic tunnel? When can we be back to our normal lives again? In a very sad face. So, so we pray that it's going to be very soon to the student who wrote this and to our community. The next question is, are the symptoms the same for both adults and kids?
Yes. I can say it can be the same. It can be the same, but for adults, it can get worsened. For kids, they can remain as having mild symptoms. However, don't take it lightly.
Right. Thank you very much. And the next question, I believe, is from Mr. Brown as well. The parent says, can Spectrum International School focus more and more on student behavior and mental health with this kind of activities from school, please?
Yeah, that's a very good question and definitely good advice. And this is something that we're trying to promote. And this is why we have the homeroom teacher session. Is really put the student welfare and their well-being, because we do know that it is very challenging for them to be stuck at home indoors and not moving around, because our educational philosophy is that when we're teaching students in school, we do like them moving around and making sure they're getting that oxygen to the brain and they're being very active. So whereas they're at home sitting down at a computer, it is very challenging for the students. So we advise our teachers to spend only 20 minutes doing an exposition and then setting an activity for the students to be engaged in. So they do the activity and then they come back to the meet and they can get feedback and share their learning outcomes. So this is what we're advising. So yeah, it's definitely something we need to look into in terms of giving that guidance to our students, how to manage being in isolation. So yeah, the feedback's definitely valuable, and we are looking at how to improve the current curriculum that we're offering in that regard.
Thank you very much. The next question we've got for Dr. Govan is from Miss Miriam. Says, my 1-year-old daughter is not accepting to wear a mask. Is it okay if she goes out without it?
Okay. Yeah, it's quite difficult for younger kids to wear masks because they might feel very uncomfortable with it. So the best suggestion is you can try to make her to wear face shield. Okay, face shield become another layer of protection for kids or also for adults. If you're seeing around nowadays, people are started to wear face shield even when they are going out. Maybe try to get a tiny cute face shield for your daughter to wear it to cover the face surface. And of course, the best thing is not to expose her to outside. If you need to bring by necessarily, and then you can try to get the face shield. Otherwise, keep her at home, keep her safe at home. That's the best thing.
Great, thank you very much. And we've got a last question for today's session, which is, if a person gets COVID and is cured, will he be immune to it? This is similar to a question we had before.
It's similar answer. It depends on the person. It's very individual, and then of course we don't encourage for the person to go swab and to check is the person immune to it or what. But it's a novel virus. As I mentioned earlier. So there are many researchers taking part to see either the person will get immune to it or not yet. But there will be a chances for the person to get back it by second exposure. So doesn't mean once you get COVID and you are safe to be outside there without mask. No, you might get the second exposure and you might get the second infection. So being careful, follow the SOP of mask and distancing is very crucial at this point of time. So never take it that we can get immune when we already acquired COVID-19 and I'm cured with everything. So doesn't mean it's going to work that way.
Thank you very much, Dr. Govind, for enlightening us on this topic, which is extremely important for everyone's safety. And we hope and pray that everybody is staying safe and playing his part in keeping the community around him safe, inshallah. Mr. Brown, I thank you very much too for being with us today. I also thank the community of Spectrum and KPJ Hospital for being present with us. And I hope that everybody has benefited from this session. We have now come to the end of the session. It's already almost 5 p.m. already. So thank you all very, very much. Please, everybody, stay safe and stay blessed. Thank you from Spectrum. Thank you on behalf of KPJ as well. I may say, wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.